just covered extinction and extinction burst. Extinction being take away something that was previously reinforcing to see a decrease in the behavior, and extinction burst being that sometimes we will see an increase in that behavior which was previously reinforced and then a more swift drop off. There are a couple other terms that, again, I just want us to be familiar with for the common vocabulary so that as we get into practical strategies, we're speaking the same language. The first is conditional probability. And when we're talking about behavioral change, again, though this may have been implicit, I want to be explicit with you, is we are very infrequently talking about direct cause and effect. So when we alter the environment, I do not want to suggest that by altering the antecedent, we will be directly causing an immediate change in behavior. What we're going to be doing is changing the likelihood of that behavior happening. Conversely, when we offer a consequence, whether it's a reinforcement or a punishment, or a positive reinforcement, a negative reinforcement, a positive punishment, a negative punishment, extinction, that we are influencing the likelihood of behavior occurring again. So when we're talking about behavioral change in general, and most specifically when we're talking about strategies as part of a behavioral parent training program, we are really talking about the probability. So changing the likelihood, not the cause. And again, I want to be obvious about that because I want you to be obvious about that with your parents. I don't want to falsely sell the message that this specific strategy will every time punish away a behavior. It's likely a strategy that works for most children, and it's likely a punishment strategy. But even an effective punishment may not work every single time. It's not directly determining the cause, it's influencing the likelihood or the probability. The next aspect of behavior change that I want to mention is discrimination, which is that individuals respond differently under different conditions. Again, that may seem very obvious to us, but specifically if we use the example of, in an hour, it'll be just about time for lunch, and we're gonna all be a little hungry. Our attention to the ongoing activity may be slightly different than it would be immediately after snack break or immediately in the morning. And discrimination in some ways makes sense in terms of conditional probability. It's not causal or determined every time we do it that we will get the desired or elicited outcome, but we're increasing the likelihood to. And we need to understand discrimination so that we can help parents to understand why some strategies may work in some contexts, but not in other contexts. In some ways, the opposite of discrimination is generalization. And often what we want, or our desired outcome, is that strategies or skills taught in one setting will generalize to other settings. And generalization is the behaviors that occur in a situation will transfer to the other situation, or teaching of one behavior may influence other behaviors. When we're talking about generalization, most typically, conversationally, people talk about that in terms of setting or environment. That a behavior learned in one setting will generalize to a behavior learned in another setting. But I also want us to be clear that behaviors can generalize to other behaviors. So for instance, though we may not have directly targeted whining, when we target aggression for punishment, that may generalize to other decreases in negative behaviors. So we might expect generalization of behaviors in terms of their increase and also in terms of their decrease, as well as setting to setting. And then finally, we were talking earlier about how prompting is an antecedent or cueing the elicitation of the behavior that we want. Fading is where we had used those prompts to help cue the performance or help along the performance. Fading is when we start to remove those prompts and see if the behavior or the performance maintains. And again, I bring these up to be clear because sometimes when we don't readily understand the difference between these concepts, we may be fading prompts and seeing changes in performance and thinking our plan doesn't work any longer, when really it's just the fading of the prompts that has contributed to it. Or we didn't provide prompts in the first place, or we have taught a skill in one strategy and we now need to understand how to help generalization or why other behaviors might be changing in terms of their increase or their decrease. So I realize I've just talked a lot about these concepts, but before we move on from this slide, are there questions about what conditional probability is, discrimination, generalization, or fading? Yes?
Is fading prescribed only by reducing frequency, or are there other ways of it?
Can you clarify for me what you mean?
For example, we're giving a compliment, or we're giving a reward in the form of a candy or something to a child in order to increase the probability of this behavior. The behavior has now gone on for a while. Is it only about decreasing how often I give the reward, and is there different ways of doing that, or is it, you know what I'm saying?
So is it only about
Do
decreasing?
I sporadically give it? In other words, is there a prescription for how to fade?
You know, those prescriptions, again, I can give some general feedback, but it's going to be individualized to the family with whom you work. And sometimes the fading of the prompt might be fading the frequency of the prompt or the nature of the prompt. So instead of I want you to do this, we might come up with a signal, a cue signal, or something that might help the child to understand when something is required of them. Alternatively, when we change the reinforcement schedule, we might see a change in behavior due to the frequency, but sometimes that can be balanced with the potency of the reward, even if it doesn't happen as frequently. So, okay.
Now you answered my question. So you can make a degree, or you can make a frequency, you can vary various ways to feed.
And again, none of those, if we increase the frequency of a reward and decrease the intensity, or increase the intensity and decrease the frequency, we may do that with the intent of changing a behavior or maintaining a behavior, but really it's looking at each individual's response to decide, did that work? So again, I hope I am sufficiently making it clear that all of the strategies that we talk about have the intent of producing certain outcomes, but part of the reason why we're going through all of this vocabulary and all these concepts about behavior management and behavior principles is because you need to be the evaluator, as does the parent, of whether or not this is working and when to change course. And part of knowing that is knowing what to expect in the course you would typically expect. Okay? Okay. I think we have successfully talked about most of these points in our discussions that we were having. So we talked about the importance of consistency and when to change consistency, immediate reinforcement, continuous reinforcement. We haven't said explicitly, so let me just quickly define those. Immediate reinforcement, as opposed to a delayed reinforcement, is when something is provided. Let me be clear. A behavior happens and the consequence happens. The consequence increases the behavior occurring again, so it's a reinforcement. Immediate reinforcement is when that consequence occurs very close in time to when the behavior occurred. A delayed reinforcer is when that consequence happens with more time in between the behavior and the consequence. So an example of that might be the behavior occurs, you can give a praise right away. Or the behavior, that would be an example of immediate reinforcement. Or a behavior occurs, and great job, you earned your birthday party a week from now. That would be a delayed reinforcement. So again, if it is in fact a reinforcer, if it's increasing behavior, both immediate and delayed reinforcers can affect behavior. But typically, for most kids and for most of us, in terms of gaining a skill or acquiring a skill or changing behavior rapidly, immediate reinforcement, it tends to elicit change more quickly than does delayed reinforcement. Continuous reinforcement is opposed to intermittent reinforcement, is every time the behavior happens, it is followed by that consequence being something that increases the likelihood of that behavior happening again. So you raised your hand, I called on you. You raised your hand, I called on you. You raised your hand, I called on you, after each occurrence of it. As opposed to intermittent reinforcement, which is you raised your hand, I called on you. You raised your hand, maybe didn't call on you this time. Raised your hand, maybe didn't call on you this time. Raised your hand, called on you this time. Continuous reinforcement typically has been found to be most helpful in acquiring a skill or learning a new skill. So every successive approximation towards that behavior, every shaping towards that behavior, every chaining towards that behavior, or I should say towards that desired outcome, typically when continuous reinforcement is provided, that happens more rapidly. In maintaining behavior, so after that behavior has been successfully achieved, it tends to maintain better with intermittent reinforcement. So we don't know when it's going to come. So it's kind of like when I pull the slot machine, am I going to win this time? I don't know, I got to keep trying. That's the analogy to intermittent reinforcement. But that tends to be most helpful in maintaining a behavior. Magnitude of reinforcement, quality of reinforcement, combined, prompts, sharing, practice. I think we've generally touched base on most of those other points. But before I move on, is there any concept that you would like me to clarify? Okay. All right. How many of you are familiar with the work of Gerald Patterson? Some of you? Okay. Gerald Patterson really was, in some ways, a pioneer of behavioral parent training because he did many studies of what we call dyadic or two-people interactions. And specifically, he studied the interactions between parents and children that occurred naturally and really looked at the quality of those interactions and their effect on disruptive or aggressive behavior. And though not always the case, oftentimes when families come to us or parents come to us, it's because their children are showing disruptive or aggressive behavior and they need help understanding why that behavior is occurring, what's maintaining it, and what to do about it. And so we won't talk about this for a terribly long time, but Patterson's work really focused on understanding the context of the environment and the context of the relationship between the parent and child, really at a behavioral level to understand how aggressive behavior or disruptive behavior could strengthen over time. And so he looked at a series of interactions that could occur between parents and kids that tended to produce typical outcomes that we'll get to. And we're going to use these cycles that he identified as a learning exercise. Because again, when we were talking about the ABCs of behavior, I mentioned that it's not just simply a linear process, but it's something that happens circularly, or parents influence kids, kids influence parents. And so again, though I, because of slides, have to present them linearly, I want us to talk about what typical outcomes might be from interaction styles that can emerge between or among parents and their children. Okay? So one thing that he identified that we've called an ideal interaction is when the adult gives a command. And when I say a command here, I don't necessarily mean a stark, staunch command, but I mean a direction or instruction to do something. So the parent or the adult gives an instruction, a direction, a command. And the child complies with that, meaning they do it. And so the behavior is done, the parent notices it and offers a reward or praises it or makes acknowledgement of that behavior. So in our ABC pattern, here the A or the antecedent would be that the parent gave a command or a direction. The B being that the child did the directive, they did the instruction, they followed through with the command. And the consequence being the behavior, the direction was followed, the parent praised it or offered acknowledgement of it. Let's say that situation didn't occur just once, didn't occur singularly, but occurred multiple times. So a dozen times, a couple scores of times, 30 times, 40 times, multiple times a day, 100 times, several times. Over time, what do you think the child's going to learn from this type of interaction with their parent?
That if I do what I want, I get approval, or I get it's good.
So if I do what I'm told to do, it feels good. I get some kind of positive feedback. I get approval. What might the parent learn about the child? My child's compliant.
Respects the parent.
My child
Wants to please the parent.
My child respects me and wants to please me.
He's doing what's expected.
My child does what's expected of me. And so I'm already starting to model not just the behavior that the parent might come to the conclusion about, but also kind of the quality or the personality of their child that they come to view. So my child's compliant. They do what I say. I really like interacting with my child. And oftentimes the behaviors, though not always, I don't want to state this too strongly, but the behaviors that parents do and the behaviors that kids do help to contribute to the attributions or the ways they view their children and their family and the way they are as a parent. And again, though we're talking about behavior and we will continue to talk about behavior and behavior strategies, I think it's important that we recognize the thoughts or the cognitions of parents that can develop over time based on really what can boil down to be a behavioral interaction that occurs. And it's important for us to recognize that as professionals too, because we might have to manage some of these attributions or cognitions that parents have to help them start to make some of these behavioral changes. But if negative cognitions have developed over time, or negative attributions about kids have developed over time, with changing successfully the interactions that parents have with their kids, we can also expect more positive attributions to develop over time. So this is an example how not just this one string of behavior, but seeing it multiple times, the parent starts to learn positive things about their child, and in turn, the child learns positive things about their parent and also strengthens the behavior that the parent wants to see. So if the parent wants to see compliance over time, that may get strengthened. So what we see as outcomes is that kids can learn that good things come from doing what they're told to do. I get attention for that. I get positive feedback. And parents learn that their child's enjoyable and compliant. But let's take another interaction. So this would be an ideal interaction. And typically we don't have parents coming to us and saying, hey, I wanted to come to behavioral parent training because things are going so beautifully at home. I really have a lot of ideal interactions with my kids. They come because other less ideal interactions or patterns of behavior have developed over time. So another pattern that Patterson identified was this one. So the adult gives a direction or a command, the child does it, and then the adult either doesn't respond or issues a new command. So let's quick break this down into our ABC cycle. What's the antecedent here?
Command.
The parent gives a command. The behavior is the child complies or does it. So in this first one to the left here, the consequence would be no attention. Okay, so if kids' behavior is, we're making an assumption here, if kids' behavior is maintained or motivated by attention, would we expect compliance to be reinforced over time? Okay, and if, well, let me just stop there for a second. In this other ABC cycle, the parent gives the command, that's A, the child's compliant, B, the consequence is another command is given or another direction is given. So something is added to that situation. What might be the outcome over time that you could expect from that cycle of behavior? And again, not just occurring once, but recurring repeatedly.
Starts with compliance, resentment, anger.
Okay. And you were saying?
Resistance from the child. I do this, I'm going to get asked more and more.
Okay. So again, and just like you guys are saying, what was found is that the adult gives a command, the child's compliant, adult's not responsive. Over time, the child learns nothing good comes from compliance, or their behavior is not strengthened. Compliance is not strengthened over time. What can typically happen, and again, I hope I'm doing a good enough job of speaking in typicalities. Typically what happens in this pattern is what I'm presenting up here. Again, not each and every time. But an adult gives a command, a child's compliant, the adult gives a new command. Child learns that compliance means I get more work put upon me. So if work is something that reduces behavior over time, because it's aversive to the child, we're doing a positive punishment. We might be decreasing compliance over the time by adding more and more. Does that make sense? Okay. Now again, when you break this down to the behavioral level, you can see a very clear antecedent behavior consequence. And sometimes this is tough for parents to recognize because they say, but there are times I do just need to give them a command, or I do just need to do this, or I can't always say thank you, or 100 other things that we've heard from parents. And I agree, each and every time, the ideal interaction can't happen. But what our balance is as treatment providers is to understand how behaviors may be strengthened or maintained at this very basic level, knowing that really it's probably never just one singular chain of events that causes and produces a lasting behavior forever. But it's a chain of events that happen in a pattern over and over and over again that strengthen a behavior or weaken a behavior. And for me as a treatment provider, that's hopeful to know, because if behaviors occur over time or difficult cycles of behavior occur over time, they can also change over time. And it's tough, but it's amenable to change. Let's go through another example. This one, the adult gives a command, the child's not responsive, perhaps by being passive. So this might not be, no, I'm not doing it, but just, go pick up your room. Okay. Playing, continue doing what they're doing. So just kind of ignoring what the parent says. And the parent gives a command again. And the child just kind of passively ignores it again, or just passively doesn't respond. Adult gives another command. Finally, the child complies. What might the child learn over time in this situation? I got a couple warnings in there. I don't have to act right away. And what does the parent learn over time? They might learn, I gotta say now. What else might they learn if this is the interaction? I gotta nag to get stuff. So if parents start to have the supposition that they have to nag their child to get compliance, how might that affect their attributions about their child in a long-term way? My kid's stubborn. They're gonna have negative thoughts. This is frustrating. Yep. Yep, and exactly. So the adult learns to nag, the child learns to wait. Again, at a basic level, it's kind of easy for us to disabuse ourselves of all of the negative attributions or cognitions that we can have about a child. We can look at this very objectively and say, oh yeah, this is the change that's happening. Of course that's the outcome. But once attributions and cognitions have started and patterns of behaviors have emerged, we can see how people, A, get stuck in patterns, but then how thoughts about their family or their child or their parent can start to emerge over time. What about this one? The adult gives a command, the child's not responsive. The adult escalates by raising their voice, being harsh, going to physical discipline, and then the child complies. What might the child learn over time with repeated patterns of this cycle?
Fear. Aggressive next fear.
Okay, so the child might learn fear. They might learn to expect escalated form of discipline. And what might the parent learn?
This kind of goes to a little bit of bullying, because when you're aggressive verbally and physically with your child, and we're all about bullying,
Yeah.
I feel bullying is like the highlight of everything, to a point, the parent actually is a bully at this point.
Okay, so you look at this and you see it as the parent being a bully. Okay, let's take a look. If it's continuous.
Violence, then the kid's gonna have to learn. Okay, well, in order to get things, I have to be physically violent.
Okay, so it sounds like what you're saying is that the child's learning to expect some escalation in discipline, and what's the parent learning about their child? I have to get angry before they're going to do what I say. I have to escalate right away to get them to do something.
Yeah, I'm connected to bullying and learning. Parent learns. You'll often hear people say, well, I was raised this way. My father never had to hit me because he threatened me, and I never, I never challenged that threat ever again after that one threat. And sometimes you hear people say, well, I'm going to, often they'll say, I get the policeman or I'll do this, that, or the other thing. So basically,
And probably what I'm hearing people say is it represents the parents learning over time, again, not through just one pattern of behavior, but learning over repeated instances of behavior with this cycle and this outcome that I have to raise my voice or I have to escalate my discipline to get compliance. And the child learning, I can expect it.
Yes, but I think, and I will say to all, as I said, I'm aware, that my definition of a raised voice is not out of anger, it's out of reality. And if you study children and understand the biology of children, they're like you, and you, and you, and you. We all have inertia. And we all have at our homes. Once we're doing something fun and pleasurable, biologically, we're going to get stuck doing it. We want to do it. We're home, we're free. And I never saw, I raised my voice a lot with my kids. Right now, sweetheart, and somebody commented now is a gift I gave my kids. And I share that because one day I'll put this up, but I don't mean to take over, but when I see that people equate raised voice with harsh, harsh is not a bad term. Coaches are harsh, but they may not be abusive.
Yep.
And what I did is I tied in my model, if I raise my voice, now sweetheart,
Yep.
now notice sweetheart, now thank you. See, I always thought that I may have to be mean sounding in order to, again, get through to my child biologically. And I have, have and had
Yep.
3 wonderful children. But if I ever write my book, it will definitely have a chapter on the raised voice, because I think the raised voice is maligned because most parents reach a point of raised voice out of anger.
Yep.
And they reach it out of anger because they magically think that I shouldn't have to raise my voice. If coaches were to run teams in that way, you wouldn't have much going on in the football, basketball.
Yep.
And coaches can be very marvelous, fine, loving guys
Yep.
and gals.
Yep.
So I
Let
don't
me,
wanna-
no, and I don't think you are. I think you're presenting a different perspective. And again, I don't think it's ever wrong for us to have multiple perspectives to consider. What I challenge everyone in here to think about and to consider are a couple of things. One, if kids are doing really well and they're very satisfied and parents are very satisfied, we oftentimes don't see them coming to us. Oftentimes parents are coming to us because the relationship that they've developed with their child is one that's not desirable. So they are struggling either to elicit compliance from their kids or struggling with their relationship with their child, but they're coming because somehow this pattern doesn't work. And again, disabusing ourselves from whether certain types of punishment are ethically or morally correct or not, and I'm not going to get into that too much now. What I want us to do as behaviorists and as helping parents change the behavior of their kids is to look at sequence of events like this to see, was this behavior reinforced? Was it punished? What was the outcome for which we were hoping to strive or to achieve? And to evaluate that critically. And to look at those singular events in the context of larger patterns of behavior that may have developed. So, one thing I think that is important is there's always going to be subjectivity and interpretation about whether a strategy worked or didn't work. And it's our job as therapists to help parents, to challenge ways they've been handling things, not because it's wrong or because we think it's wrong, but because we're trying to help them develop a different pattern of behavior with their children and to try something different to see if it produces a more meaningful outcome or a more meaningful relationship, which is why they're coming to us in the first place. So again, I am presenting these because I want to, review the work of Patterson because it's so instrumental to the development of most current behavioral parent training models. But 2, as a learning exercise for us to understand as professionals how behavior may have developed over time, and then also to provide then a voice or a mirror for our families to understand how behaviors have developed over time. So we're using these as learning exercises, but at the same time, I think it's great that you're keeping a critical mind and a critical evaluation standpoint to these, because it's already showing that you are trying to understand how behaviors can emerge so you can best help your family. So I encourage you to keep doing that.
Can I do a quick little question?
Sure.
In dealing with, in relationship, adults, children, baby, young ones, the importance of tone. When I'm very busy and husband, whoever something and what, he knows, leave me alone, let me finish what I'm doing. When I have a little doggy, I come sit, baby, sit, 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 it sits. In younger children, you see that, Tommy, is that addressed, the tone of voice? It does not necessarily have to be a negative, using tone as a positive, just a way of communicating.
Yep. Let me actually, if you don't mind, open this up to the larger group. So speaking generally, tone of voice and the way we give directions. I don't want to get into yet whether it's right, wrong, or otherwise, but in terms of our behavioral chain, do you see tone of voice and the way we give directions as an antecedent, a behavior, or a consequence? An antecedent. Okay, so the way we give directions, the tone of the voice, the nature of which we do it, might influence whether or not that behavior happens, meaning sit happened or come over here happens. So let's think about that, because actually we have a whole session for parents on how to give directions. And that was one of the things I was going to ask you is, how you would conceptualize giving commands or directions in the context of the ABC model. So we've clarified already, it's really an antecedent. It's not going to cause compliance every time, but it might influence it. And we'll get more into the pragmatics of good directions and what to instruct parents on.
I was just going to add that I do think that tone is important, and to the gentleman's credit, we talk about coaches and how they use volume and tone to coach a team. I think there's a difference between coaches in the athletic sense. Is their tone and volume is usually always there, whether it be good or bad. When you have a parent that's using a loud volume or tone, strictly when they're giving direction, it then takes a negative connotation. So if you are loud always when things are good or when things are going great, that's different than it only coming when you're giving a direction or reprimand.
That's an interesting point, and I'm going to take what you said for a second and take away the negative connotation. If the only time we use a loud tone of voice or a harsh tone of voice is when giving directions, and at no other point, whether we think that's right, wrong, or otherwise, essentially we're providing discriminative stimuli to our I almost said students, to our kids. So we're cueing them or providing discriminative stimulus that something is about to happen. I start to get loud, it might cue you that a direction's about to come. Right, wrong, or otherwise, whether the directions are followed, I just wanted to point that out, that I think what you very eloquently stated is that parents might be setting up a discriminative stimulus. And if that's what they want, they achieve their goal. If that's not what they want, then we might need to approach it from a different way. Oop, sorry. Yep.
I just wonder if we might consider as well that intense emotional involvement is typically when we think about that in discipline, we're thinking about negative. And I think you're asking us to consider that intense emotional involvement could actually be one of the cycles that produces a more comfortable, positive relationship between parent and child, not necessarily negative involvement.
Yep.
And so that tone of voice might be one cue for an intense emotional involvement that leads to a coercive cycle in the world. And would be then called coercive.
Right.
So it's some semantics for that.
Yes, I do think some semantics are at play. And again, as I hope we get into skills, we can think about the application of these skills for the variety of families and parents with whom you work. Let's cover a few more just because I want to do our due justice to Patterson. In this cycle, he identified that sometimes parents can give a command. The child may be non-compliant or show a lack of compliance. The adult issues the command again. In this situation, rather than the parent escalating, the child escalates. So the child has a tantrum or breaks things or yells, but escalates their behavior somehow. And the adult withdraws. Child wants control. Okay, so what's the child learning? He wants to get control. What else is the child learning?
That the parent is going to escape and having to give you commands.
So when I ramp it up, I get out of what it is that I wanted to do. And what's the parent learning about the child? That my child might not be controllable? Okay. If I tell my child to do something, they're going to escalate, or the parent might learn, I just need to disengage, ignore, withdraw from my child, because every time I try to engage, it blows up in my face. Okay. Nothing works. Yep, I think a lot of what we're echoing here again is probably echoing the thoughts that parents start to develop when they are in frustrating patterns or frustrating situations, that it can extend beyond just looking at what happened in the immediate sense to making these qualitative judgments about their families and kids. And again, I'm not saying that in a blaming way, but more in a way to highlight how that can happen. And again, part of our job as therapists is not just to teach parents new skills, but teach them how to enact those new skills by, honoring the position that they come from. They might have been very withdrawn from their kids, and even engaging is going to be something they struggle with. Or they might have very negative positions about their children, which is distressing for them. But honoring that's this skill of redeveloping their relationship with their child might be one that takes some time and they need some support on. So knowing not only the coercive cycles that may have developed, but also looking at the outcomes that may have developed in terms of the way the parent's viewing the child or the child's viewing the parent is important in changing that cycle, and important for us to recognize when we help parents to implement or to try new strategies with their kids. Okay, let me take a breather for a moment, because what we've just gotten through in a very nuts and bolts way is social learning theory, and many of the factors or aspects of social learning theory that we are to be aware of when we move into behavioral parent training and learn how to enact behavioral parent training with our parents. So before leaving that, are there questions that I can answer about any behavioral terms? Okay. So, oh yes, please.
It's more of a comment. What we find challenging in a clinical setting when we're working with parents, whether office-based or in the home, giving commands, is when it's an extended family member, and other members in the family who are also part of giving direction to children, and the styles, unfortunately, are not always compatible.
Sure.
And the confusion that can cause a child is enormous, and very often it fuels a child's non-compliant behavior. You've got aunt and uncles and the whole grandparents, parents, in their own styles giving direction. That
Sure.
doesn't always
Yep.
to a desired outcome. So sometimes it's not always that parent-child transaction. But it can become a little
Other things in their environment, so other people in their environment, other cues in their environment. Our kids don't live in a vacuum. They live in a complex world. And so you're right, sometimes we have to involve more than just the direct caregivers, but maybe some of the ancillary caregivers that might be contributing to behaviors.
because there's a diversity piece to it too. I know in our country, lots of newcomers coming from the homeland, moving into the home. So these dynamics play out in
Yep.
an interesting way.
And I don't devalue these dynamics, but in part it's, for me as a therapist, part of the appeal of behavioral parent training, because we know that we all learn in similar ways. Our behaviors, whether we're saying one set of words or a different set of words, if behavior is increasing, it's being reinforced. And if a behavior is decreasing, it's being punished. So again, as we're talking about these strategies, of course there are going to be modifications that have to be made for individual families or individual cultures. But what we need to look at as therapists is it changing the behavioral pattern as we would expect? And if not, coming back to figuring out what's maintaining the behavior, what's punishing the behavior, what's reinforcing the behavior. Yes?
I just want to also piggyback on what she said, because it's true, because like the kid might be going to school and then go with grandma and grandpa after school, or auntie or whoever, and they have their parents in silent. If you're talking about grandparents, they're going to have their silent ways and may not believe in any kind of therapy. And then you have the mom or the dad or mom and dad, and even if mom and dad, they're inconsistent in parenting. So you have a lot of dynamics going on, and And like she said, they can get very confused, because I can get away with a lot more with grandma and grandpa.
Yep.
Maybe, or grandma, or whatever, than I can with my mom
Yep.
or dad, or I can go to more with mom than dad, and it's just.
Let me challenge again as a therapist, because part of what I've heard you say is that kids, when they have multiple people in their lives, can learn, I can get away with a lot more with grandma than I can with grandpa, or I can learn to get away with more with grandma than I can with mom. But they learn that pattern of behavior, just as they learn their pattern of behavior with their parents. And so I want to emphasize that these patterns of behavior aren't immutable. They are changing, and they are always changing, whether intentional or unintentional. Our relationships with people are ever changing. So yes, barriers like that or struggles like that may make certain skills difficult to implement. But I do want to challenge us to think creatively about anytime a child has learned a pattern of behavior, there is a different pattern of behavior that they can learn. And every time a parent's learned one stylistic approach, there's a different stylistic approach. And our job as behavioral therapists and as behavioral parenting therapists is not to force parents into one way of dealing with their kids and one way only, but to be a guide and a coach and a support to parents as they figure out what works for them and their kids and their family, with the ultimate goal of changing the behaviors that are problematic and improving that relationship. So I absolutely agree and honor what you're saying, and I think it's important for us to reflect upon that and hear upon that, but also consider how are we going to move around those barriers using these principles, or how might we not even look at them as barriers any longer, but just look at them as antecedents or consequences in a child's life, and work on changing those antecedents or consequences if it might produce a more favorable outcome. So, yeah, I hear you.
Especially in Miami, with these multi-million cultures, and one is married to this, and the home, one is Hispanic, one is Creole, one is English.
Sure.
Ooh, we better know to adjust to them and help them right where they are.
Right. Yeah, I think one of the great things about a conference like this and a workshop like this is that we're all here for the intent of learning skills that we can help parents learn. And again, part of my motivation for wanting to go through aspects of behavioral change so that you can take those and apply them within the context of with whom or the context in which you're working, because there are 100 degrees of variability, and we need to understand principles in the context of variability. So behavioral parent training is really taking these principles and applying them in strategic ways to help parents identify patterns and then help them to change those patterns. We teach parents typical antecedents and typical consequences that over time help produce more positive outcomes in their children and develop more positive interactions with their kids. This slide is up here intentionally because I want to highlight a couple of things. One, we're helping parents to identify what have become problematic behavior patterns for them, and to identify and change those patterns that are problematic in their family. Two is, when we're talking about skills, we're going to be talking about skills that are typically antecedents, typically consequences. And I emphasize typically because of course there is variability. Of course there are exceptions. If someone is not motivated by attention, or attention is not a reinforcing agent, then the skills that are predicated upon attention being a positive or reinforcing agent would not be applied in the same way. So when we're learning about those skills, again, I charge you and challenge you to understand them in the context in which they were developed and tested, so that way if they are not working, you can understand the context in which they may not be working, or evaluate when you would stop using a strategy or start using a strategy. Yes?
Maybe I'm getting a little repetitive, but so in your setting, in your therapy settings, do you then, first talk about what the problem is and try to figure out the antecedents, behaviors, and consequences, and then do you teach them the steps of behavior, modification, or social learning?
Sometimes yes and sometimes no. Oftentimes, We will meet with families to identify what might be maintaining consequences or antecedents to understand it from a therapist perspective. Whether that's always a necessary first step, there might be situations in which it's not always necessary due to urgency or time or whatnot, but typically I think having an understanding of that is most certainly helpful. And yes, we do share with parents, not in the level of detail that I have provided you, but essentially the social learning theory process, and help parents to identify when strategies are antecedent-based strategies or consequence-based strategies, because again, if we can do a service to parents by helping them understand the context in which behaviors may develop or change, if essentially we work ourselves out of a job, that's the outcome that we want. We want parents to be charged as their own agents of change. So yes and no. And as we go through sessions and skills specifically, one thing that I'll be distributing later today is a manual for you, which is an adaptation of the MTA parent training manual that has study-specific elements removed from it, but really are the core behavioral principles and are the behavioral principles that I'll review with you here in a second in a session-by-session programmatic way. And I provide this as a guide, but also hope that as we go through those skills, and we'll work through those sessions session by session so that you understand the skills, but I hope that you will come away with that as a guide rather than a prescriptive approach you have to use with every single family. I don't know if that was more or less answering your question. Okay, so behavioral parent training. I'm going to go through some examples of publicly available or commercially available behavioral parent training programs because I want to identify and highlight some of the commonalities among them to then take those commonalities and start to apply it in a strategic way. So first is the Triple P, which is Positive Parenting Program. Some of the components of Triple P, which is a behavioral parent training program, is it's on average 10 sessions. Depending on the expediency in which parents learn and implement skills, it can be as few as 6, as many as 15 sessions. It was developed for pre-adolescents, and it focuses on these 4 things: developing positive relationships, or how to spend quality time with kids, how to talk to kids, how to show affection, encouraging desirable behavior, aka strategically reinforcing desired behavior through using praise, giving attention, providing engaging activities. It focuses on teaching new skills and behaviors. So prompting, cueing, chaining, teaching skills. So through things like setting good examples, using incidental teaching, using strategies like ask, say, do, using behavioral charts. And finally, managing misbehaviors through strategies like ground rules, directed discussion, planned ignoring, clear expectations, logical consequences, quiet time, using timeout. So those are the components of the Triple P parenting program, which is a behavioral parent training program for pre-adolescents. And again, I'm presenting each of these to highlight the abundance of commonality among them, and we are essentially extracting those commonalities in sessions to then give to you to work with parents.
Is that their group model or even their individualized?
So there is, what the question is this their group model? There is group Triple P, which is delivered at a group level. There's also multiple levels of intensity embedded in the larger Triple P program, including working individually with parents. So yes, so this is based upon their group program, but it is very highly similar to their individual program. But again, the individual program allows for flexibility, and in some respects, as does the group program. But specifically, the slide is off of their group Triple P. Parent-child interaction therapy focuses on mastering skills through the help of a coach, again, developed for pre-adolescents. There are essentially 2 phases in parent-child interaction therapy, which is behavioral parent training: a child-directed phase and a parent-directed phase, which focuses on these things: parents following children's lead, avoiding commands, questions, or criticism, praising appropriate behavior, using reflective talk, playing, describing appropriate behavior, enthusiasm, essentially focusing on strengthening the relationship with the child. And then the parent-directed piece, I'll be with you in just a second, which emphasizes consistency, predictability, follow through. The parent learns to give commands, time out, ignore behavior, problem solve, house rules. Yes? For PCIT? It was originally developed for younger kiddos, and there have been, the reason why I included pre-adolescents is because there have been studies upwardly extending the age limit of parent-child interaction therapy. So if you read the manual, it was originally developed, and the efficacy trials done for much younger kids.
Much younger, what age?
3 to 6, really.
Oh, good.
But upward extensions of the age limits have been done, as have modifications to parent-child interaction therapy. So that's why I put pre-adolescent. Yep.
Can you also use some of these, because I used to work in a patient setting with adolescents from age 12 to 18 with comorbidity, a lot of substance use and mental health issues. And I mean, I know by the time they come to us, the parent-child relationship is very poor or severed because they're running away, they're in criminal activity, they're skipping school, you know, it's just a multitude of problems. And, you know, we used to have parent classes and just having them understand about addiction, but also mental health and why everything that being filled to their kid, you know, and just basics, trying to repair those bonds was, you know, and really having programs that continuously get cut to help, you know, for these, you know, for this short time, 2 weeks, you know, helping people that have adolescents that are problematic. We really need to focus on that as well because a lot of times, sometimes it's already lost. So, you know, a lot of times the crises are happening in middle school. I find like I can write a book on how many kids like middle school. I think, can these things, these models like you're going to show us, be used for people with adolescents, because a lot of times that is so severed and so so damaged that
again,
trying to get that back.
I hear you.
You know,
And
it's like school age.
what I think is so fantastic about behavioral principles in general, hence them being principles, is that this is the way humans typically learn. So behaviors reinforced, punished. So can these general principles be applied to preschool age children or adolescents? Sure, they're the governing principles of learning in all humans. Now, do you want to make adaptations when working with a preschool population? Absolutely. And would you make adaptations to implementation with an adolescent population? Absolutely. And just because one study tested these principles up to age 12, does that mean we couldn't try it with a 13-year-old? I don't think that's the conclusion that anyone would want us to come away with. I think sometimes treatments are developed and they have to be tested to figure out if they work, and so you have to define a population to do that. And so when I'm presenting, for instance, parent-child interaction having been tested in a pre-adolescent population, to my knowledge, I don't know of the application of that specific parent training approach in an adolescent population. Does that mean it couldn't work? We don't know the answer to that. But in general, part of the reason why I'm presenting this is to highlight for you the commonalities that exist across many behavioral parent training programs, because they are in fact based upon social learning theory. And I want us to understand what is common among PCIT and PPP and COPE and helping the non-compliant child, etc., so that we come away with that skill set of common principles to move forward with our families. I'm not advocating that you never purchase a manualized treatment program. Some of these beautifully lay out sessions and do a fantastic job. But I wanted for this workshop for us to come away with understanding those principles in the context of social learning theory, those principles applying them to families, and then for you to come away with a skill set to use when working with families. And if that would be supplemented by any of these manualized interventions, I highly endorse many of them. So I would say, knock your socks off. Parenting the Strong-Willed Child, another commercially available parent training program. This is a 5-week program that was developed and tested in kids ages 2 to 6. Again, I want us to focus on what the core principles or skill sets being taught are. How to pay attention to your child or provide attention. how to use rewards, how to ignore, how to give directions, how to use timeout. Cunningham's COPE model. So Chuck is presenting on the community parent training model right now, which is one specific model of behavioral parent training. And again, that program focuses on attending, rewards, ignoring, managing transitions, planning ahead, point systems, problem solving, communication, homeschool connection. Parent management training, Kasdan's program, it's an 11 to 15 week program, again in pre-adolescence, focusing on point charts and praise, timeout, attending, planned ignoring, shaping, problem solving, low rate behaviors, reprimand, compromise. Incredible Years, which is typically 12 or more sessions for younger ages, 3 to 10, focuses on play, praise and rewards, limit setting, handling misbehavior. So we just kind of identified some of the common elements of behavioral parent training programs. I also wanted to draw your attention to a recent meta-analysis that was done. And a meta-analysis is when you take many published studies and look for common metrics or create a common metric for the outcomes of those studies. So you can synthesize a large number of studies to come up with general conclusions. So again, Chuck presented on this yesterday, and I won't belabor it too long, but again, I want us to be mindful of the common elements of behavioral parent training and the effective ingredients of behavioral parent training. So the meta-analysis that was done looked at different treatment components of behavioral parent training programs to find out what were the most effective components or the most effective ingredients and the least effective components or least effective ingredients across 77 published studies of behavioral parent training programs. So what they found was that programs that had the least or the smallest effect size meaning a common metric of change. So you can compare effect sizes from really 0.1 to 0.3 being small, the next section 0.3 to 0.6 being medium, 0.6 and above really being large. It takes whatever the outcome measurement was and puts it on the same metric. The ones that have the least effect, the components were teaching parents problem-solving skills. Now, does teaching parents problem-solving skills harm them? No, it doesn't harm them, but in terms of what's going to give you the most bang for your buck or the biggest punch, that had a smaller punch. So if that is a main component of a behavioral parent training approach, it has less of an effect than some other things. Teaching parents to promote children's cognitive, academic, or social skills. Again, was that harmful to children? No, but in terms of what produced the biggest change or was the most effective ingredient in change, that was less of an effect. And then finally, other services, generically defined as other services. So that naturally lends itself then to what produced the biggest effect or the largest effect. And those were programs that focused on increasing positive parent-child interactions, that focused on teaching parents time out, that taught parents the importance of consistency, and those that required practice of skills with children during the parenting session. So those programs that had those essential ingredients produced the largest effect. And again, as therapists, I want you to keep that in mind because there are probably some skills that you're teaching parents that would be very amenable to having kids coming in and practicing in session, and other times where you might say, I need to try a different modality or work up to that eventually. I want you to have the knowledge of what is most likely to produce meaningful change for families so that as you're structuring your parent training sessions and you're working with parents, you can strategically choose when to use the most effective ingredients and how. So again, these were the 4 things that were found to produce the biggest change in parents. Yes?
You might or might not have an example, but when we go back to the least bang for your money, does anything come to your mind or the audience in terms of teaching parents to promote children's cognitive, academic, or social skills. Is there an example where I, as a parent, would be teaching my child a cognitive skill that does not work? You know, in other words, any verbal example of that?
A verbal example of that. So I want to clarify that it's not that it doesn't work, but just compared to other, the smaller effect. That might be an example of, you know, teaching kids strategies that they could say to themselves to help keep their cool when they're starting to get angry. Again, that's not that it doesn't work, but in terms of producing change, it seems to have less of a potent impact than teaching parents a strategy like timeout and how to use it effectively when misbehavior occurs. I am not advocating that you don't use that approach at all. I just wanted to give a sense from the study of what they found. I think that's an interesting study. I think you can take away from it strategies and kind of a priority list, but I think you also have to be mindful of those results in the context of the families with whom you work.
And I'm sure there was a lot of variability in it.
Of course there was, yes.
But I was wondering, in terms of that metric change, was it typically change in the child's presentation, or was it typically change in the parents? Or maybe both?
Most, yeah, some, and that's what's tough about meta-analyses is because not every study measures change the same way. So some studies will measure change from direct observation of the parent-child relationship and have a third party rate that. Others, it might be objective indices of how frequently does that child follow directions. Other might be parents' report of, are things better at home? Others might be kids' report of, are things better at home? So that spans a wide range of different possible outcomes. And of course, there are some outcomes that are probably more objective and some outcomes that are more subjective. So again, this is a piece of information for you as a therapist in the context of the families with whom you work. Yes?
I'm just thinking, because you're just saying that cognitive, and whereas yesterday cognitive behavioral therapy was, they said over that we were very successful and this, and we want to change the cognitive.
Let me be clear, because I think there's a point of confusion happening. This is for behavioral parenting programs. That's not to say for treating anxiety that teaching cognitive skill replacement or cognitive behavioral therapy isn't effective. This was specifically a study done of behavioral parent training programs. Okay? Okay. Let me pause for a moment and check how we're doing on time. Okay. So, before moving on to starting to get into some actual skills then of how do we teach parents skills and how do we teach them some commonalities of skills across programs, so kind of getting more into the meat of what to do. Are there questions that you have about social learning theory, about behavioral parent training models, or about this meta-analysis that I can clarify? Okay, so what I'm going to do then is go through very generally with you, intentionally general. Right now, what we're going to be covering for the remaining day and a half of our workshop. And I'm staying general for two reasons. One, because we will be going into each of these components in sessions and practicing them more in detail. And two, I want to kind of tip my hat as to what's to come, but also mindful that we have very few minutes before we break for lunch. So what will we be going into in this afternoon and then for the remainder of tomorrow is a behavioral parent training program that's adapted from the MTA study, but which is essentially a synthesis of all of those behavioral parent training programs that we just reviewed. And we'll be going through sessions on social learning change and behavior change, attending and developing special bonding time between parents and kids, how to teach parents to use reward and how to use ignoring, how to use the PREMAC principle, how to give effective commands, establish rules, and reward compliance, how to teach parents to do timeout, how to do a home token economy, a daily report card, response cost, and then planned activities. So that's kind of the meat of what we'll be getting into. What I want to highlight is that these skills tend to move from least complex to more complex. So the skills presented in 7, 8, 9, 10 are more intensive or potent, presumably potent, more intensive programmatic skills that we can use to set up with parents. Much of the success of these programs working is predicated upon parents successfully using some of these less intensive but equally important skills. So, for instance, if we want a daily report card to work, we have to know that a parent knows how to praise and spend time with a child. This is what we're going to be working through the next day and a half. I'm presenting this to you in the context of a manual, and of a manual that outlines sessions, so that during the first several times that you're using this, if you want to use it as a straight manual, you can do so. We'll be going through the different components of the sessions available in this manual, role-playing some of them, making sure we understand how to help parents implement it. But then in addition, I want us to be mindful of how to adapt some of these strategies and develop some of these strategies for our specific families.